the joint care technique that most people never learn. All you need is a marble. When you run, the force through your foot is equivalent to 3 to 4 times your body weight. Certain athletes can experience forces of 5 to 8 times their body weight. Your feet are designed to manage, redirect and return force, and how well they do that affects your entire movement system. This isn't a quick fix, it's about calming tension, improving how your tissues move, and helping your body handle force more comfortably over time. So we use 3 different types of marble: small, medium and large. Start bigger if you're sensitive and work with smaller as you get more comfortable. Using the marble as a massage tool is effective because it's small and easy to maneuver into those hard to reach areas. A small surface area can access deeper layers of tissue, and because of its size, it's convenient. You can take it with you anywhere, do it often, which can allow for compounding effects over time. There is a caveat to this technique. You should be able to comfortably place your ankle on your thigh while maintaining a straight back. Never force yourself into positions. Once you picked your ball, let's start with the heel. To start the massage, place the marble in the palm of your hand and support your foot with the other hand. Gently press the marble into the heel and find a pressure that feels manageable. Tension is normal, sharp pain is not. And this is what it's going to look like. So without my hand in the way, it's going to look like that. So I'm going to move down from the back of the heel here, all the way down like that. And I'll just cover it just underneath the ankle bone and around the back of the heel, and then the same on the other side. So my hand angle might change, but I'm still going down towards the heel. So I'm wrapping around the base of the heel. Next I'll move to the arch and start at the side of the heel and then gradually scrub until I get to the inside base of my big toe, to about here. It can be quite sensitive there, so I'm going to spend some time massaging that and then come back round again. If you look at the pigmentation of my skin, it kind of changes from tan to whiter, and so I'm going to follow that pigmentation line all the way to there. Right, if I put it on the outside edge, which you can just about see there. So that can be quite tender, so take your time. And don't press too hard to start with, build up. It doesn't need to be hard, you just need to do it regularly. So full tempo looks like this. So once I've done the top of the arch here, I'm going to use a side-to-side action and cover the whole arch, the inside of the arch. So here, like this. You can change the angle to diagonal, between side to side and diagonal. So it'll look like this. This type of action, feeling the warmth, but it shouldn't make you jump out of your skin. So then I'm going to move into the midfoot. So I've covered the heel, and I've covered the arch. Now I'm going to go to the midfoot. And when I do my midfoot, I'm just going to go forwards and backwards. And I'm going to branch out a little bit as well towards the direction of the big toe and little toe. After I've done that, I'm going to do some side-to-side action as well for the transverse fibers. So it looks like this, forwards and backwards. A little bit of a branching out there towards the big toe. So I'm going full tempo. Like I said, I'm used to doing it, so I can go a little harder. but I'm still not hammering myself. It might look like that, but I'm making sure I'm not applying too much pressure. I definitely feel the tissue warming, and I feel the tension easing, but I'm not hammering my foot. I definitely don't want any bruising. But I do feel a tense spot here as I approach my little toe towards the base of the little toe, and here as well. So I'm just going to do that for a little bit longer. So once I've done the forward branching out, I can go sideways. So it looks like this. Now I'm going to progress to the ball of the foot. And here, I'm going to continue this forwards and backwards, but I'm going to branch out towards the toes here more. So forwards and backwards, and then branching out. I can trace around the line of the base of the big toe here. Also go across. So don't force it. Take your time. Build up. So you're enhancing foot-brain communication, getting a lot of feedback with the ball and your foot. You're also getting to know your foot and where you carry your tension. Then I'm going to again go to lateral to work the transverse fibers. So next I'm going to scrub the underside of the big toe. So I'm going to move along to here. And again, it's going to look a bit like this. Now, if this ball's a bit too big, just switch to a smaller marble. So obviously I use my palm, but I'm demonstrating what I'm doing like this. So again, the underside, the edge here, the inside edge. Just look for tender areas. So using my palm there like that. So I'm trapping the big toe, trying to keep my foot steady and scrubbing. Feels really good. Clearing up some tension in the big toe. Once I've done that, I can move to the other toes. So if I move my big toe out of the way, it just looks a bit like that. And again, you can do the other toes. Don't have to spend too long doing it. Giving them all a bit of attention. So now I'm going to finish with some light strokes with my fingers. And then I'll go back to the toes, start with the toes and then to the heel and ankle. Very light. Just gently sweeping from the toes back to the ankle. And then back up the ankle towards the calf. And finished. Massage won't change the structure of your foot, but it eases tension, helps tissues move more smoothly, and improves how your brain coordinates your feet and toes, so movement can feel more efficient and comfortable. If your feet and toes get tense or restricted, it can change how you distribute weight when you walk or run. This can put extra strain on your feet, ankles, knees, hips, and back. But if we can release and reduce some of that tension, your toes are going to move much more freely, which is going to have a positive impact in your walking mechanics. I'm not a foot specialist. I work with the whole body and use advanced techniques for every major joint, not just the feet. This is just one piece of a bigger system I'll be sharing throughout this series. To help you build on this, I put together a free short video with a simple foot and toe mobility assessment, plus effective exercises for your arches and toes. You'll find that in the description below. Quick safety note, this video is general movement education, not medical advice. If you have a medical condition or under medical care, check with a healthcare professional before using pressure-based techniques. Always stay within comfortable limits and stop if anything feels painful or unwell. If this was useful, I'll be sharing more routines for the rest of the body coming soon. Let me know in the comments which area you would like me to cover next.